Hello, I'm Dr. Strawford and I'm the Medical Director of Skin Excellence Clinics. Welcome to this Q&A session. I'm going to share with you lots of questions that I'm often asked when patients are coming to have a consultation with me.
I've noticed dark patches of skin on my face. What could be the cause of this?
So this is hyperpigmentation. It's likely dark patches on the skin is where you get what we call hyperpigmentation, and the most common cause for this is sun damage. And this is where the pigment cells come together through inflammation or sun damage on the skin, and they aggregate together, and then that area of the skin appears darker. Now this can be very patchy pigmentation, it could be just more widespread, it could be an area that's very localized and more dark, and that's called a solar lentigo or a sunspot. But we have to be careful with pigmentation on the skin, because if it's a certain type, very dark, irregular pigmentation, it's new, it's changing rapidly, then it could be a melanoma, which is quite a dangerous skin cancer. So it depends on the history. If it's pigmentation that you've had a long time, it's not particularly changing, it might get darker in the summer through the light, then it's likely to be sun damage, okay? There is another condition which is more common in younger women and people, which is called melasma. And this is where, again, we don't know why this happens, but the pigment cells come together, and this can be often affecting the forehead and sometimes the upper lip. And melasma is sometimes associated with pregnancy. They call it the pregnancy mask, or it can be associated with the oral contraceptive pill. There's another form of hyperpigmentation.
How can sun damage or hyperpigmentation be treated?
So with sun damage and hyperpigmentation that's associated with this is very common, especially in the later years when people are getting to their 40s, 50s, 60s and older, that we're seeing these irregular pigmentation appearing on the skin. We can actually assess for that and look even beneath the skin, and we do 3D camera analysis and skin analysis where we can show you that pigmentation in the early stages before it comes to the surface of the skin, and we can sort of map how our treatments are working by measuring that pigmentation through that system. So we have lots of ways of treating sun damage and hyperpigmentation, but the common ways is we can suppress some of that overactivity of the pigment cells using some very simple topical serums. Now there's an enzyme called tyrosinase which is actually controlling the pigment cells, and we can block the effect of that enzyme with some of our topical serums, and preventing further sun damage by using a very effective sun protection, a UV protection, obviously, is very important. So we have a range of topical skincare that can help with pigmentation. We often use photobiomodulation or light therapy. Both the near infrared and the red light can suppress the inflammation and suppress the pigment cells. So we're often combining our topical treatments with light therapy, as we call it. Some of our chemical peels are very effective at suppressing pigmentation and reversing some of those changes. But if we have very stubborn areas of pigmentation or solar lentigo discrete patches, then we do a very effective treatment which is called cryotherapy. This is a selective freezing of the pigment cells. So it's literally a liquid nitrogen spray, a very intense spray. We put a bit of a local anesthetic on to make it painless. We can actually freeze those pigment cells. And that works very effectively in killing them off. So that is a permanent treatment for those pigment cells. The way it works is the pigment cells, the melanocytes, are much more sensitive to the cold because of the freezing effect than the skin itself. So the skin recovers quite nicely. And we often see we can get a complete reversal of that hyperpigmentation with cryotherapy.